This is Balsam, a positive, funny, ambitious girl who's trying her best to build herself a successful future. Balsam is a college student, a loving sister, and a true friend. She's energetic, kind, and full of enthusiasm. Until one day, a reckless driver turned her life upside down. Balsam lost her left hand. But being the positive person she is, she was not gonna let that stop her from chasing her dreams.
Welcome to the Arab American University. Today we'll be heading to the Occupational Therapy Department to learn and see how occupational therapists work and intervene with amputees.
To start a treatment process, we will be going through a step-by-step protocol. This protocol includes 4 phases.
Phase 1 involves initial management and protective healing. This phase begins immediately after the injury and continues until all wounds have successfully closed and are free of infection.
The therapist performs a comprehensive evaluation and assessment of the patient's physical and emotional baseline status. The patient's medical history is obtained with special attention to all injuries that impact care and long-term goals.
Some things must be taken into account to maintain the patient's safety, which are activities of daily living, desensitization, wound healing, upper limb flexibility, body symmetry and exercise, pain management strategies throughout rehabilitation, and psychological support.
This phase begins at wound closure and ends with acquisition of preparatory prosthesis. Patients entering the second phase may require additional psychological support, peer support, activities of daily living, adaptive equipment, and change of dominance.
The focus of this phase is for the patient to master control of the prosthetic limb, integrate prostheses use in activity performance, and ultimately reach independence in all activities of daily living.
Phase 4 begins approximately 8 to 16 weeks after the initiation of rehabilitation. The goals of this phase are for the patient to complete basic and advanced daily tasks, incorporating the prosthesis efficiently and demonstrating a natural motor pattern.
The outcomes of this phase is for the patient to save body energy and decrease biomechanical stress to the intact limb.
The information collected during the initial evaluation is very important for discharge planning, trying to provide a smooth transition from one level of care to the other.
Transitions to different level of care may be stressful, so to reduce that, the patient is introduced to local support groups and amputee groups.
Occupational therapy is all about adding the fun to functional.
Occupational therapy is all about thoughtfulness, kindness, and compassion.
Occupational therapy is change and inspiration.
An occupational therapist should be strong enough to tolerate everything and soft enough to understand everyone.
And that's just a little bit of what occupational therapists do. We hope that you enjoyed this video and thank you for watching.
هعمل ماسك كده ضل ساكت كل وكل ما تقطع هعمل فيديو بتنمحى افكر انا بدي افش ايدك ايش يا دكتور شو بنتعذب احنا خلاص يلا
Incorporating the prosthesis efficiently.
هو ضل ما طلعش واحنا بنصور وبعدين راح ننزل بعدين طالع مش هنخلص تصوير مش هنخلص لا ولا شيء ما بيبين نشفت الطبق
طيب هتعملوا بالجامعة عشان ارجعي
تعالي
انا رجعت عليك